Good morning, Dr. Umar.
Good morning, Kenny.
Welcome to our safe space at Suria KLCC. This year's celebration of the World Mental Health Day, which was on last Thursday, right?
That's right, 10th of October every year.
Yeah. I'm sure you were very busy then, this period of time.
Yeah, we had a lot of awareness programs. I think that's the main thing, awareness, to create awareness among the public.
Right. But thank you very much, Doctor, for saying yes and coming here to share some knowledge about mental health. Specifically on suicide, which is a difficult topic to talk about, right? And I think for people who are listening in, who are watching, right, if they feel affected by the content, what can they do about it?
We have actually several crisis helplines. So if they are actually watching and they feel emotionally affected by the content of the discussion, they can actually call up several crisis helplines, especially BEFRIENDERS. We have our crisis helpline by the Ministry of Health, which is called Talian Heal. And there are several others like Buddy Bear, Miasa helpline. So they can always reach out to these helplines.
And it's very convenient right now, right? Because I think after our MCO and pandemic, right, there are so many helplines that's available right now.
Totally agree with you.
And by the way, I'm Kenny and I'm from BEFRIENDERS KL.
My pleasure meeting you, Kenny.
Thank you. Okay. So let's dive into our conversation today about suicide, about mental health, and something which is very much related to the theme of this year's celebration for Suria KLCC, which is cyberbullying. Be kind online. So, according to the National Health and Mobility Survey 2023, they found that those from younger age group, specifically 16 to 19 years of age, right, are more prone to experiencing feelings of depression. And when we talk about young people, right, most of them are also spending a lot of time online, on social media, and that's where you get all this cyberbullying, right?
Totally agree.
What would you say your experience is like? Do you see more patients who are younger nowadays?
Yes, definitely. Let me share a little bit about our National Health and Mobility Survey findings in 2022. 2022. In fact, what they found was 1 in 8 of the adolescents had suicidal thought. 1 in 10 had attempted suicide. So that was worrying actually, because the trend in Malaysia from the National Health and Mobility Survey in 2017, there's an increase in, from 10% in 2017 to 13.1% in NHMS 2022. So there's a definite increase in those harboring suicidal thoughts, and there's an increase from 6.9% to 9.5% for those who had attempted suicide. Among the adolescents, and most of them are girls as compared to boys, and the girls, like 13.4% had attempted suicide as compared to 5.7 among the boys. So it's been a worrying trend actually, and Ministry of Health has taken up this task of trying to modify this and trying to reduce the risk of adolescents having these depressive symptoms. In fact, studies have shown, right, in Malaysia, 1 in 4 adolescents have depression, actually, depressive symptoms, and not all of them actually come forward to seek treatment, because a lot of them go undetected. So we are actually trying to advocate counselors, school counselors, to be able to screen and pick up these kids, the children and adolescents, especially in school, because they spend most of the time in school. And we are also trying to educate parents to be more aware of their changes in behavior in their children. And also, because your children and adolescents, as compared to adults, right? Their presentation of depressive symptoms may vary. So they wouldn't come out with like crying spells, saying that I feel depressed. Okay, so it may reflect in their academic performance. So you may find a fairly good student, suddenly you find a decline in their academic performance, and they may be socially more isolated, right? And they are less interactive with their family members. So these are the key things, or the red flag signs that we actually tell parents to look out for. Because looking at our this atmosphere, right? Our academic atmosphere in Malaysia, it's more academically inclined. So there's a lot of expectations and demands on the children. And children and adolescents, when they are growing, right, that's where they actually form their identity. They're trying to maintain social relationships. They're trying to perform well academically, and it's all exam based. So the pressure is very high on them. And not all of them actually come out and seek help, because number one, they don't realize that they are facing stress. So we try to educate in schools as well. So we create these awareness programs with the counsellors in school. So Ministry of Education is doing that. So they are allowing counsellors, they are actually advocating the school counsellors to do screening. So they have the depression, anxiety and stress scale, where they do that to screen, and they find that if there's a significant change, or significantly unhealthy DAS scoring or screening, they would take them on, counsellors, and if they cannot manage, they would refer to the hospitals or the clinic kesihatans lah. They're available. So
it's very important basically to create that awareness, self-awareness, as well as having the knowledge to detect people around you, right?
Yeah, that's right.
So there's also program at school to basically educate students on this. What do you think about public awareness on this issue?
Well, public awareness is also really very important, especially now. This year's theme for World Mental Health Day is prioritizing mental health in workplace. So we find that there's a majority of those having mental health issues, right, fall between, or even suicidal ideas and suicidal attempt and behavior, right? Most of them actually fall between the 15-year and 49-year category, that time frame. So they are very productive. So we are talking about them being at work. So if we neglect those who are at work and those who are productive, right? So we tend to miss the big chunk of educating the public. So we're just talking about children, school, and probably extremes of age, but we tend to forget those who are actually in the the working group, right? So this is very important, because we are talking about productivity, right? So creating awareness. So we have several programs. I think Ministry of Health, BEFRIENDERS, you have gone all out with your road shows talking about mental health and suicide prevention. It's very very commendable, actually.
Thank you.
So so I think it's really important, because we are using all media, face to face, road shows. We set up booths in fair, educational fair, occupational fair, those kind of. We set up a booth and we try to advocate and talk about mental health issues.
And I think we also try to use social media, because I see KKM's social media is quite active as well. And BEFRIENDERS KL, we also try to do that. But when it comes to social media, right, it's not really a very safe space to be at times, right?
Yes.
So sometimes you get really nasty comments, negative comments. How does one deal with it, right? Especially the younger ones. It may affect their mental health, right? Getting comments that's difficult.
Agreed.
So,
because what we find is that we've had younger patients, younger clients who actually resort to social media to find help for their suicidal thoughts or their depressive symptoms, right? There are positives and negatives about social media. When someone feels isolated, they actually they use social media to connect. We have support groups online, we have mental health communities online, but not all of them are credible. Some of them actually give a lot of misinformation. I have people coming and telling me, no, I'm on this social support group, and they're saying, do not take medications, right? Because it causes kidney damage, and then you'll be dependent on medication. Those are misinformation, right? So the positives are they can actually connect with someone, help online. They can, like I said, mental health communities, they can express themselves. So using that as a platform to express themselves and still remain in anonymity. Some of them, it takes a lot of courage actually to come forward and talk about your challenges and your mental health issues. So most of them actually use the social media, but it has to be credible information that we get. So a lot of children and adolescents, they resort to social media, but it's not time limited. So to create that healthy, online, kind of communication, it has to be time limited. So we have to actually educate parents to restrict children's time online. And some of them actually, these children and adolescents, even adults, it's like an indirect, non-verbal way of trying to end their lives, where we have clients finding ways to end their lives online. And you'd be surprised, actually, there are several websites who actually encourage this. So we are trying to advocate and teach them healthy online behavior, actually.
Right. That's important, basically.
Very important.
Right. So talking about parents' role, right? How can they support their children in terms of their mental well-being, including, spending time online or generally?
Right? Well, I think nowadays, right, parents are holding 2 jobs. Mom and dad are both working, so they tend to I won't say not neglect, but there's lack of time with the children. So what we advise parents is, please make sure you spend time with your children. If you have 5 kids, you have to have one-to-one time with your one-on-one time with your kid. Because even if it's 12 minutes, 15 minutes per day, it's actually protected time that you have with your children, where you listen to them. Listen to them openly, with an open mind, and also non-judgmentally. Because sometimes children find it so difficult to relate to their parents because parents are so busy and they may be doing their work or on their phones, and when the child actually tries to talk to them, they will say, just give me 5 minutes. So they tend to dismiss them. Once a child is dismissed, they would actually clam up, and most children would not open up again. So they feel that, I'm troubling my parent. So to have open discussions, open and healthy discussions with your children, and also knowing which websites they are actually surfing, and also creating a healthy regime. Where healthy surfing regime or healthy online behavior kind of regime. And also teaching your kids basic things like having structured sleep, having structured activities actually, and healthy diet, because the foundation of a good mental health is actually adequate sleep, adequate activities, and a healthy diet. So if they do not have this strong foundation, everything goes a bit haywire. So parents actually play a very big role. So no matter how tired you are, right, after coming back from work, or you just need to spend a few minutes with your children, just listening to them, asking them how school was, who did you hang out with, because it's very sad when we see children, adolescent clients, right? When we talk to them, when we ask them, who do you spend your break time with? Who do you eat with? Oh, I eat alone. And it's very sad because it actually reflects on their social network that they have at school. So it makes someone actually feel, makes me understand that, they are very isolated in school. So their social network is really important. So the parents have to know who their friends are, what they're hanging out with, what they're talking to, right? And also communicating with their teachers, right? Because a lot of this kind of behavior, teachers may not convey to the parents, so sometimes teachers don't even tell, right? We have teachers who miss conveying to the parents that the child didn't turn up to class, right? And the parent finds out much later that the child has been playing truant and not being attending school. So it's quite worrying actually. So we need to be on the ground with the kids and support them.
That connection is really important, right?
That trusting relationship. So we need to make our kids feel validated. So even though their question sounds silly to some people, right? But they just need to be, they want to be validated, and they want to be listened to.
So on this note, right, validating their feelings, what they are sharing with us, how can we be a good listener to people who are struggling?
Right. Actually, the first thing is, making them, having a conversation where you do not interrupt when someone's talking to you, right? Listening with empathy. Empathy means you're placing yourself in that person's situation and trying to understand the feelings that they're going through, because that emotional pain that they're going through, it's so difficult because it's related to psychological experiences, and a lot of them who are suffering from overwhelming emotional pain, actually this overwhelming emotional pain motivates suicidal behavior, so they do not know where to seek help, so they actually motivates them to hurting themselves, or thinking of ways to end their lives, because they feel they want out of this emotional pain. It's an intense distress that they feel, but they cannot communicate these feelings. So they feel, and that's where your online platform, your crisis helplines help. But first and foremost, to be a good listener to someone is to listen with empathy and do not judge a person. Sometimes when someone says that, I've been having suicidal thoughts, on and off, do not judge them and say, hey, you need to be more spiritually inclined, you're judging the person, right? Or you need to be stronger, right? So you're just trying to say that, the person is weak for having these suicidal thoughts. So this is the most important thing, so validating their emotions, saying that when they say this, try to say things like, yes, I understand this is difficult for you, right? And I know you're going through a difficult time, but there is always help there, and I can help you seek help. Tell them, make them feel safe. When someone expresses suicidal thoughts, right, you just validate those thoughts and tell them that help is available. So at that point in time, when we ask that question, sometimes they do not, in our culture, they do not easily come up with things like, I feel like not living anymore, or I feel like ending my life. It's not that easy. A lot of them actually come with, somatic pains like headaches. I feel very tired. I cannot sleep. We have a lot of clients coming to our primary healthcare center or GPs complaining about, inability to sleep. Not having appetite, not able to concentrate. It reflects depression, and depression pushes your risk of suicide much higher. So that is how we have to be just present for that person, to tell them, look, I'm here to help you. Right.
So basically, it means doctors also need to have that awareness, right?
Definitely,
How to
yeah.
recognize people who are struggling.
Exactly, right?
And for us, Befrienders KL, we feel that it is also very important to be able to ask that question, right? When you notice there are these changes,
Yeah.
symptoms, right? It's basically okay to ask that question. Doctor?
Definitely okay. In fact, studies have shown that asking about suicide is very protective. So when we ask about suicide, it's like you can ask directly, or you can actually ask in a way that, if you see, I'm concerned about you recently. Is there something that you want to share? Or you can actually ask directly, right? When someone is going through difficult times and struggling with their emotions, they feel that the only way out is to hurt themselves or to take their lives. Do you feel that way? So asking that question makes someone feel that, oh, I'm not alone. And someone here understands that. Because talking about suicide is such a taboo topic anywhere, not only in Malaysia, anywhere across the board.
Right.
So people shy away from asking about suicide, but we encourage people to ask that one question, because asking that one question could save a life.
Yes. But many people are also afraid, if I ask the question, what if they say, yes, I'm suicidal, yes, I'm planning to end my life. So what would be your advice to that?
I think we have to be prepared ourselves. Where can I get help? Okay,
Right.
God forbid if the person does say, yes, I've been hurting myself recently, and right now I just feel there is no way out, because for a person who is experiencing suicidal ideas, they are very ambivalent actually. Not majority of them do not want to end their lives, but they feel that they are pushed to a corner and they are struggling with this intense emotional pain, and there is no outlet because they do not know how to communicate this emotional pain. So they feel that they are pushed to a corner and there's no way out, and the only way is to actually end their suffering. Okay, and they do not want to, they feel that they are burden to other people. So when they say that, we have to be aware that definitely there are crisis helplines, but there are, in Ministry of Health, we have primary healthcare centers, our clinic kesihatan, where they do mental health screening. And in most general hospitals, we have the psychiatry and mental health department, where you can actually get a referral from the clinic kesihatan and come to see a psychiatrist or a psychiatry medical officer in the psychiatry clinic. You can go to the emergency department of any general hospital saying that you are having suicidal thoughts and you need help. Right? And the other thing is our community mental health centers that we call Mentari. Right? So we have several, more than 30 in Malaysia, across Malaysia. So this is a mental health center in the community to reduce the stigma. So they don't feel that I'm coming to a psychiatric clinic. Right? So they come to these community mental health centers and we do a screening there, and if it's very acute, you are made to see a doctor there and then. Okay, if they find that they can do some initial intervention, they will get you an early appointment to see a doctor.
Okay.
So there are several ways and several avenues to get help for someone who's suicidal. But if someone who has already hurt himself or herself, we just call 999, get the ambulance in and take them to the hospital, nearest hospital. But in that process, during that time, we have to be there to make sure that the person is safe. That's what we need to do.
So there are actually a lot of places that they can go to. Clinic Kesihatan first, Mentari, right?
Yes.
But the sad thing is that a lot of people out there do not know about this. And I guess that's why we are here talking about it, right? So that many more people would know what to do when they are struggling, right?
Exactly,
And I'm also very intrigued by what you said earlier, right? Most people basically choose to end their life not because they want to end their life, it's because of the pain, the unbearable emotional pain that they're going through, right? So what is the relationship between emotional pain and suicide?
Well, emotional pain, it's actually a response, to any psychological reaction or experience that we've had. So it depends on the intensity of the emotional pain lah. Emotional pain does motivate suicidal behavior, but it does not. It's not the only factor that motivates suicidal behavior. It's actually a confluence of various factors. Okay, number one, if someone is struggling with emotional pain, do they have the ability to communicate that I'm actually struggling with this intense emotions, or do they find that are they not able to find help? Sometimes they do not know where to get help. All right, and a lot of it is actually related to depressive symptoms, the way we think. Because when we are depressed, our thinking, our cognition becomes more depressed. Right, so we feel that you are very critical of yourself. You feel that you're a burden. You have a lot of self-guilt, self-hate. And all these can actually confluence lah. It's actually a interplay of several factors, not only emotional pain, which actually pushes the risk for suicide higher. But emotional pain, when they are able to talk about it, encourage them to talk about it and express this pain, it actually reduces that suicide risk or the self-harm risk.
So it's very, very important that we are able to express how we are feeling not only in terms of being happy about it, right?
Exactly, a lot of them mask their emotions. On the outside they appear to be happy, but on the inside they're actually struggling with a lot of thoughts. But this emotional pain can actually affect your thoughts and your behavior as well. So that's where your thoughts become very negative and very pessimistic. So it snowballs into something big. And if they feel that there is no avenue out, there's no way out, they will actually resort to self-harm or suicidal behavior.
Right. And earlier also you mentioned about medication.
Yes.
When someone comes to a psychiatrist, not all the time, right? Most probably they will end up taking medication. And you've also mentioned that there's this myth that says that medication is bad for your health and all those.
You get a lot of that, because when we start, actually, the medication is only started if a person has been diagnosed to have either moderate to severe clinical depression, or we call it major depressive disorder, for depression lah. So if they have a comorbid or anxiety symptoms as well, it actually pushes up your depression. We want your depression outcome. So the earlier we start medication, the better outcome we have, right? But it only depends on the severity of depression. But like I said, not all persons coming with depressive symptoms are treated with antidepressants. Some of them coming with mild depression because they have maladaptive coping skills. So we focus on helping them cope with their issues or cope with their struggling emotion, rather than start them on medications right away. But there's a lot of myths about, misinformation about antidepressants, where they feel that they will be dependent. Once they start antidepressant, they will be dependent for the rest of their lives, which is not true. In fact, when someone is diagnosed to have depression, the minimum that we give, we always tell our clients that you have to take medication for at least 6 to 9 months. But that depends on the stressor or life event that person is going through. If they're having prolonged life event, they probably need to be on a longer term antidepressants, and the other factors as well. So would actually, influence the duration of treatment for the antidepressants. But it's not, you don't become dependent on antidepressants at all. Right. And it doesn't cause kidney damage or so a lot of them come with this, my neighbor said that it causes kidney damage, so I only take it as and when. And antidepressants do not act like that. So you cannot take as and when. You have to take it every day. Only then it actually affects your neurotransmitters in your brain to make you feel better.
I've also heard people telling me that, I'm afraid of the side effects, if you take medication, you will become like this,
Side
What about
effects,
side effects?
Usually, it's actually our duty as practitioners, right? When we start medication for our clients, we tell them about the side effects first, and we tell them that side effects are temporary.
Okay.
Because initially, when they start taking and they develop side effects, they may not like, oh my gosh, I'm having the side effects, I might as well stop the
Yes,
medication.
yeah.
So what we do is we tell them that this is temporary. So if it's not too severe, carry on with the medication, right? But it gets too severe, we give them a lifeline. You can always call the clinic. You know, you can either email us, come to the clinic saying that you have side effects. So come and approach us, and we tell them that we have different types of antidepressants. So if this doesn't work for you, we can actually try something else for you. You know, so we educate them before we send them back.
Okay. So basically, when you go to a clinic, right, and see a psychiatrist, you are in a safe hands. You are in safe hands, lah,
Yes,
right?
definitely. Our nurses are trained, our paramedics are trained, so that the way we approach someone who's coming with depressive symptoms or even suicidal ideas and suicidal behavior, we are trained to be empathetic, you know, and we are trained to be not judgmental.
Okay.
Right, yeah.
What would be your advice to people who are struggling out there, but they're afraid to reach out or to go to a clinic kesihatan?
Actually, it takes a lot of courage and a lot of strength to come forward with your emotional pain. So when someone actually comes to us, we credit them, you know, we commend them for their effort to come forward to seek help, because we are trying to say that you're not alone. There is help out there, and there is support out there. Okay, and we are here to support you. You know, so this is the thing that we want to get across. That come to us if you are struggling with emotional pain, because we will give you the support that you need, and we give you the help that you need to make you feel safe.
Right. Okay. And a lot of times, right, those people who are considering to go to see a psychiatrist, they will say things like, "Oh, when I go to the clinic, I would not know what to say. You know, everything will go blank, and I end up not saying anything."
Yeah, sometimes I have had clients who do not say anything because they do not know how to express themselves. So we just give them a piece of paper and a pen and write down. If you feel like writing down, write down. So we try to open up, you know, any possibilities of, you know, encourage them to actually talk about it. I have one client who types on their phone, and you know, they communicate that way because they feel that what's the best way to take? They do not know the best way of telling us, and if it's their first visit, they feel that someone is judging them, you know, so they may not be readily open to share their thoughts and their emotions. So we give them, you know, choices on how to openly talk about their emotions. So pen, paper, and us being there, like I said, being empathetic, understanding that this person is actually struggling so much, and to come here, it takes so much of strength and energy to come here, to go through the registration process. Is not easy in the hospital where you wait for a long time at the registration counter because you're our workload, right? So for them to come and actually end up in our clinic, we have to give them that benefit, you know. So being present, just being present with them makes them feel safe and makes them feel validated. Sometimes we don't even need to say anything, right, in the beginning. So they just need to feel safe. That's
Just
all.
being there is so helpful,
just being
right?
present
Yeah.
really makes a big deal.
Yeah. Sometimes, you know, when people approach us and tell us that they're struggling, even though we don't know what to say to them, right? You know, just stay with them, and that would be very, very helpful.
Agree. Just being there with them to make them feel that they're not alone, and someone cares for them. I think that's the most important thing.
Right.
You know.
Right.
Sometimes you feel that okay, maybe the person prefers to be left alone, but in actual fact, just being there, don't say anything. Sometimes you just don't need to say anything. Just be present.
Yeah, that's true.
And it really makes them feel supported. You know.
Okay. So, Doctor, going back to the earlier part of our conversation, right? You mentioned that according to the NHMS survey, right, they found that more girls actually have suicidal ideation,
Attempt
as well,
attempt.
right? So is there a difference, like in terms of your client, your patients, even?
Yeah. We have a lot of female clients coming with suicidal attempts, but actually studies have shown that fatalities related to suicidal behavior is more towards the males, and females come with attempts, you know, but this is actually, you know, people are crying out for help. You know, it's a cry for help where they do not know how to reach out, so they hurt themselves or they harm themselves, and they come to the emergency department to get help. You know, so we get a lot of women coming, female clients coming with suicidal attempt as compared to males.
Right.
But now we see more and more. The trend is actually, it's very dynamic.
Oh, okay.
Sometimes we get more of men, sometimes we get more of men, but generally it's the women who actually come with suicidal attempt.
Yeah. So you mentioned that suicide is a cry for help.
Yeah.
But also there are many people who say that, oh, it's just about wanting attention.
Yeah, it's not.
Being selfish.
Yeah, exactly. A lot of them judge them. You know, we have clients coming repeatedly to the emergency department, you know, with suicidal behavior, suicidal ideas. They're actually struggling. No one wants to have this suicidal thoughts. They want to have the normal, active lives, right? No one wants to come, you know, like I mentioned, no one wants to come to the emergency department of a government hospital where you are, you know, you have to wait for a long time. This is their way of actually asking. So we take every suicidal attempt seriously. So why is this person coming repeatedly? What is this person trying to tell us? Right? So each suicidal attempt is, we take it very seriously, and we do all our what you call this, a screening. So we do intensive screening at the emergency department itself. So we have to refrain from saying that you saja-saja coming and, you know, making our lives difficult. So we should not make those discriminatory comments. You know, so we should take every attempt very seriously. It's not not asking for attention. You know, it's not a way of asking for attention.
Right. So that is definitely a myth, that they're asking for attention.
Yes. So it's not a cry for attention. It's actually a cry for help.
Yes, and it's important for us to create that safe space for them.
Yes.
Right, just like this space,
Agreed.
a safe space.
A safe space. Agreed.
Yeah. Thank you very much, Doctor, for sharing so much about this difficult topic on suicide. Right. Before I let you go, one last question. What would be your hope, you know, when we talk about suicide prevention or mental health awareness for our country, Malaysia?
Actually, number one, suicide is everyone's business. You know, it's not only mental health professionals or, you know, NGOs like BEFRIENDERS talking about suicide prevention. So whatever, you know, suicide is actually, we will call it an illness, a non-communicable illness, suicide, right? So any non-communicable illness or communicable illness always starts with prevention. You know, so prevention is, we are talking about awareness. So it's everyone's duty to talk about suicide prevention, you know, and everyone's duty to be a gatekeeper for suicide. So everyone should have this kind of awareness to help someone who is, we never know. It could be a family member, it could be a close friend, it could be a colleague at work, you know, who has been so happy all the while, suddenly he comes with, you know, depressive symptoms and saying that, look, I've been having suicidal behavior. What do you do? You know, so it's our duty, right? Like I said, suicide is everyone's business. So it's our duty. So in Malaysia, we're trying to advocate that. So we are training everyone, gatekeepers, you know, as gatekeepers to suicide prevention, right? So hopefully, you know, since BEFRIENDERS, you know, Miyasa is doing a great job in suicide prevention. So keep it up, Kenny.
Thank you very much, Doctor. Thank you. I think before we go, so we want to remind those listeners out there, right? if you're struggling with emotional pain or even suicidal thoughts, can always call Befrienders KL.
Yes.
The number is 0376272929, and also they can call Talian Hill, Doctor.
Talian Hill, yeah, it's 15555.
Okay,
15555. And just a note that you can actually get on My Sejahtera, right? I think everyone's forgotten about My
Yes.
Sejahtera. So
What is on My
My
Sejahtera?
Sejahtera, we have there is, when you open up the front page of My Sejahtera, you have My Minda.
Okay.
So when we click on My Minda, actually we have the Talian Hill is already there.
Right.
And there's also a column, about self-care. So how do you learn about self-care? There's another item about screening about on suicide.
All right.
You can screen suicide, you have Talian Hill, and you can also book an appointment at the health clinic nearby on My Sejahtera.
Oh, okay.
Right?
That's very, very helpful.
So, so this is the initiative of Ministry of Health Malaysia for this. So even booking appointments using this My Sejahtera has been really helpful. We have a lot of people coming forward to see us just using My Sejahtera.
That's
and
really
booking
good. Yeah, I think that's one way of reducing stigma as well.
Definitely,
right?
definitely. Right.
Okay. So thank you very much, Doctor.
Welcome. It's been my pleasure.
Yeah, hope to catch up with you again soon.
Definitely.
And talk about suicide and everything. Yeah.
Definitely. Thank you so much, Kenny.
Thank you, Doctor.
Thank you.
Thank you.